Hi, I'm Dr. Kate Elden and Chief Medical Officer at Dutch. We looked at 2 years of telehealth data from Labrador Retriever mixes across the US, and these are the findings every lab mix owner should know. The 3 most important health patterns we found in these dogs are allergies and ear infections, joint issues, and anxiety. Let me walk you through each one. Allergies and ear infections sit nearly tied at the top of our data, and that's not a coincidence. They're clinically linked. Allergies showed up in 23% of all consults, and ear infections followed at 15%. When we looked at allergy consults, 22% also mentioned ear issues, even when the ear wasn't the main reason for the visit. This is the classic lab pattern. Skin allergy flares first and the ear canal follows. There's also a lab-specific risk factor, water. Swimming and bathing were mentioned in about 12% of ear consult notes. Dropped ears, trap moisture, and warm, wet ear canals are where bacteria and yeast thrive. If your lab mix swims regularly, drying those ears thoroughly every time is one of the most effective things that you can do. And to help them stay dry, use an ear cleaner with a drying agent. Here's the finding I really want lab mix owners to pay attention to. Joint consults appear at 1.53 times the all-dog rate, but that number doesn't tell the full story. In young and adult lab mixes, joint issues are nearly absent. Then something shifts. By the mature years, they start to climb. And in dogs over 12, joints become the single most common reason for a vet visit at 17.6% of senior consults. The dogs that fare best are the ones whose pet parents started paying attention in the middle age. Healthy weight, joint support, a baseline orthopedic assessment before the problems are visible. Don't wait for a limp to start the conversation. Anxiety shows up almost double the rate of purebred Labrador Retrievers in our data. About 1 in 8 anxiety consults notes mention a rescue or adoption history, and lab mixes are one of the most commonly adopted breeds in the country. This isn't a temperament issue, it's a treatable medical pattern, and the dogs who do best are the ones whose owners addressed it early. So if you have a lab mix, here's what to take away. Dry those ears after every swim. It's the most preventable risk factor. And if ear infections keep coming back, the allergy is what needs to be treated. Don't wait until age 12. Think about joints. Start paying attention in the middle years, around age 5 or 6. And if your dog came from a rescue and is showing anxiety, that's worth a vet conversation now. These 3 patterns are common, they're connected, and they're all very manageable with the right care. If you want to talk through any of this for your specific dog, our vets are available 24/7. There's a link in the comments to learn more about Dutch and how to get started.